So Emmanuel, do I have permission?
Yeah, sir. Over to you, sir.
Okay,
And
so can I have the slide up?
our panel members. Yeah.
Thank you, thank you. So without much ado, let's get into the main part of the evening. And as we promised earlier, thank you to all the participants to come in here and look at learning as one of the opportunities. Unfortunately, due to the pandemic, life is happening very virtually. A physical presence obviously changes the tonality and the warmth, but we're trying really hard to maintain the warmth and the tonality of the program. I think we also promised you that whatever you try and learn over the past 2 odd days, 3 odd days, we culminate into some sort of experiential learning with a panel which is actually put up for this group of people. And let me, before introducing the panel, I'll tell you the objective of the panel. I think we have started this series called Healthcare Industry Dialogue, Unlocking Value. The idea is very simple. There are many things that are happening around us and many people are there to sort of guide us into the future. So this is the first of that series. And without much ado, let me start introducing the panel members, one by one. So next slide, sir. So I take a lot of pleasure in, introducing Joy Chakravarti, not a person who's not very well known. He's actually very well known. And beyond that, I think you should all use your chat box to, wish him a very, very happy birthday. He's as young as he can be. So thanks a lot, Joy Saab, for joining. As you can see, he's already on the helm of affairs in PD Hinduja. He's an alumnus of Harvard, and also I think I'm Ahmedabad. Plus, he's also very active on the various trade forums. And I personally have worked with him for the past 3.5, 4 years on the CII Western Region Core Committee. And it's a pleasure actually working with him. And in spite of his birthday, he has chosen to take time off. Really appreciate from the depth of the heart, Joy. Welcome. And hopefully we should be able to relieve you quickly so that your family has some time to spend with you also. So we'll ensure that. So thanks a lot, Joy.
You will be kind enough to do that.
Sure, Joy. So next up, needless to mention, I was mentioning the DJ in the house. Beyond that, I think Dr. Sanjay Arora is a very different person, a person who has started a chain of diagnostic labs, which is doing extremely well, suburban diagnostics, especially in the western part of Mumbai. Clinician himself, has variety of things that he loves. And what I love about his entire profile, he loves Marshall Goldsmith, and that's precisely a spirit of an entrepreneur. What got you here cannot get you there. So what was right yesterday in the spirit of the pandemic is also maybe not right tomorrow. I think what perspectives Dr. Sanjay Arora can possibly give us today is very, very action oriented, because he's seeing things from the diagnostic side of the business. And that's what is the power that he brings to the panel. Welcome, sir. Thanks a lot for taking time off.
Thank you so much.
And I'm glad we are meeting virtually. There is a promise that we should have met physically, but we'll keep that promise for the future.
Thank you, Krishnan, for inviting me. And thank you for allowing me to be part of this, great panel and this great, event of unlocking value. I think it's a great initiative by Merrill. And again, happy birthday to Joy first, of course.
Yeah, absolutely. Thank you, Dr. Sanjay. The next up, he is a person that I've known for my entire healthcare career, and a person of many facets, has over 22 years of experience and has multitude of things. Apart from being an NABH assessor, today he runs the successful Zydus group of hospitals in Ahmedabad, and he's been doing that for the past 3 to 4 years. They're consistently #1 in the circuit of Ahmedabad. And he has worked across the country, not one setup, all the large setups he has worked. And none other than Dr. Sajan Nair. I've actually pulled him out of his so-called holiday. Again, there is us between him and his family. Thanks a lot, Dr. Sajan, for joining in. Really appreciate you taking time off. But it is always a pleasure to have you share your valuable inputs to us.
Thanks, Krishnan, and thanks to Merrill to invite me for this super duper program. And it's a privilege to be on sharing the platform with these great guys. And Joy, before we go on, a very happy birthday to you. Thanks, Krishna.
Yes, sir. Next, please. I think this gentleman probably needs absolutely no introduction when it comes to any person who works in the medical devices field. If you have to work in the medical devices field, you have to go through him. because he is part of the Apollo CPO. He's got an illustrious career, if you see. Started from, Hinduja Hospital to Meenakshi Mission to Malabar to even within Apollo. And now he is a core member of the Apollo CPO unit, Central Purchasing Unit. None other than Mr. Muruganathan, and he's a Vice President Materials. Personally, a great, humble person, man of extreme knowledge. And I'm really thankful that he could take some time off today to share. And he's not a person who attends many events. On that count, I'm really thankful that he has chosen to attend this and grace this August panel. So thanks a lot, sir. Have a great evening. Look forward to many conversations with you. You're muted, sir.
Yeah. Thanks, Krishnan. Thanks a lot for the MERIL for arranging such a great, timely event. And I'm privileged to be part of the panel along with other members. Thank you.
Thank you, sir. Thank you. And finally, he's generally saved the best for the last. So we have actually managed to find someone who has crossed borders, crossed industries, and in fact continents, who has come back to India, none other than Mr. Madan Sampath, who is the country head and the procurement and SCM head of Aster group based in Bangalore. He's currently working out of home, and that's how we have built this panel. So Madan Saab, really appreciate you coming in. I know, and I really remember you mentioning that since you're the youngest in the panel in terms of your coming to India experience, but not from an experience of work, look forward to your cross-border international views in terms of how do you see this overall piece changing. We'll talk about it. But once again, thanks a lot for gracing your presence on this August panel, sir.
Thank you, Krish. I'm looking forward for the interaction. Thank you, everyone.
So without much ado, I think we have introduced the panel. The last slide is about me. So I have been chosen to become the moderator, and I'll try my best. It's actually a great learning opportunity. I'm currently working with all of these gentlemen in some form or the other. And it's been a daily learning. And today, over the next 1.5 hours, what we will try and do, and my personal endeavor would be to maybe take some valuable inputs from them and transfer it to the people who are part of the supply chain program, and maybe some people who are also watching on the MERIL YouTube page. So what we'll do, the entire evening is spread on about a couple of sessions. The first session is about learnings. Let me quickly go to the first session, which is about learnings. And here I will seek some support from the panelists. If you could, share some unique perspectives, and we have limited time, so we'll give you about 5 minutes, and somebody has to help me with the timer here, right, Emmanuel?
Yes, sir.
I'm guessing yes. Okay. So I'll start with a simple question. Pre-COVID, post-COVID, whatever you call it, pandemic. Are there any quick learnings that you want to sort of quickly talk about from a perspective of pandemic, and how you have been able to manage, leverage, learn from the entire piece? So, Joy, your 2 cents on this.
Thank you, Krishnan. And I want to thank MERIL for inviting me. So though it is my birthday, you have mentioned and other panelists have mentioned, but let me tell you, I feel very happy when I come across this distinguished panelist, and when I interact with them and I learn from them. So I think birthday is a day to learn and grow yourself further in the next level. So I am not directly handling the procurement or the supply chain, but let me tell you, this pandemic since March 2020 has given us a lot of learnings, and every day we have learned things in a new way. And what are those learnings? First, you have to be very agile. We started in the month of March with a learning or other advice that you need to use mask. And I was very happy to hear that example in the previous session when the professor was taking classes for the other participants. Initially, there was a specification. I'm talking about from my hospital experience. It may not be the same in other places, because from place to place, things have differed in terms of, introduction of all these. Because in different parts of the country, the pandemic entered or started at different point of time. So we had specification that you start with surgical mask. If you are directly in the patient care, then N95 mask, and so on and all. And one of the previous session attendee has mentioned about only one supplier. But for us, the major challenge was that only one supplier at the initial stage was also not having adequate stock. So we started looking for alternate, and in no time we realized that in the market there are very few supplier in the month of March, April, and we are counting on different recommendations. When we started getting those suppliers and their supply, the next thing was how credible they are. You know, in the market, so much of fake things started coming, so much of branded products were coming, and we realized it is not meeting the specification given for use. And that led to a situation that every sample you get, you test it through your in-house team. So the thing is, whatever you get the product, reliability was something what we are required to do at each and every point of time. The third thing came in terms of price. We started buying at a particular price, and in no time we realized the new vendors are jacking up and it is going nowhere. You cannot make your healthcare delivery, whatever process, viable at the price what you have committed to your patients. And soon after that, especially in Maharashtra, probably the first state where government came up with a huge price regulation. And when the price regulation came into effect, the first pressure was on the supply chain people that you need to get me things at the right price. Maharashtra again, probably the first state which brought down the cost of RT-PCR testing from 4,500 to 2,500 rupees. So in no time we are required to request the existing supplier that we cannot pay you so much, then I have to conduct test at a negative margin. So that is not possible. You have to bring it down. So the thing is, first is your credible supplier, right price at the time. Third came, at the same time, that how do you juggle between the price given by the regulator and your delivery process. Fourth very important thing I want to say is, even though you are ready to pay, even though you are ready to wait, even though you are testing and getting the right product, the supplies were interrupted. We were fortunate enough being in the center of the city with a good credibility, long number of years of existence. So we could do something, but I could see and feel that other hospitals in the same city, they are finding it extremely difficult, even though they are ready to pay money, but from where to get? So these, in principles of materials management, you have the 6 R's. So I am touching upon all these 6 R's were becoming really challenging for us to manage in that situation, and that became possible only with a very agile system, a very good team in place, and some of them are participating today. I want to acknowledge their support. And finally, I'm sure Krishnan is the witness. I realized this 1 R, which is not part of your typical management principles, the relationship with your vendor. And we did that. We acknowledged that. We conducted virtual meeting with them. We acknowledged their support, and we wanted to tell them the way we are in the front line and we are fighting, maybe they are not there in the similar way, but without the support of the supplier, without the support of my vendor, I cannot function, I cannot work, and I need them. I have to have them next to me in this fight.
Great, Joy. I think
Very important thing is having them with you. So these are the first few opening points I wanted to talk about, and with this, over to you.
So I think great. I've just picked up some key words in here. I think agility is what I could sort of sense. Credibility is what I could pick up here. I picked up relationship big time. I could see the entire shift to relationship, which is becoming very important because sustaining business is also important with a vendor. And also I could realize earnings management was something that has become a learning. A lot of your own learnings are around how to manage the VUCA element and how to manage the so-called product mix and manage the earnings. Fair. So let me quickly again go to the next person here, Dr. Arora. From your perspective, you have seen it from a very different lens compared to all other panelists. What would your learnings sort of come out at this point in time, having seen what you've seen?
So actually, when you have a panel like this and you have a opening batsman like Joy, I think we needed Joy in Australia also today. He single-handedly may have actually got India, through. So we need strong opening batsmen like Joy and the Indian cricket team for sure. So when you have an opening batsman like Joy, who actually has covered everything really well, I was listening to him and making notes myself. I think he's focused on most of the key points. 2-3 points from my perspective, Krishnan. First is, diagnostics got that kind of focus as an entity probably for the first time. We have never seen the kind of focus on testing as much as we have seen in this pandemic. I think everything depended on the outcome of testing. So, the supply chain to get you the kits and the supply chain to get you the samples. But finally, it is the testing that, so there was a huge emphasis on diagnostics as such. And I think diagnostics truly is getting its, place under the sun at this point. And overall healthcare in general is, but I think diagnostics in particular. So I think that was a great moment of pride for us when we were the first lab on 22nd of March to be given the approval by ICMR to do COVID testing. So that was a huge, feather in our cap and a matter of huge pride. And at that time, we were not, there was so much of uncertainty, and we were not sure how do we, what is it that we are, getting ourselves into. But the first thing that we had to do was to display courage. There was so much of fear and uncertainty and anxiety within the team because we had to go out on the battlefield and actually collect the samples. So the first learning that I had at that time was to be with the team shoulder to shoulder. So lead by example was perhaps the biggest learning for us, that we were actually there at the ground level. We actually created a virtual war room concept on Zoom. And we were there with the team on ground, shoulder to shoulder, trying to motivate them and give them that kind of courage that, it's okay to go out and, collect the samples, because unless you get the samples, no matter how many tests you can do, but you need to get the samples first. So for me was, how do we build that sense of courage within the team? So overcoming your fear and then giving the courage to the team was perhaps, the starting point for us. The other big learning for me was that when you connect people to a common purpose, things get done. And I always ask people, why do you want to join healthcare? And it'll be nice, if you get a chance to ask Madan his experience of being, in different industries, how does it feel to be part of the healthcare industry? So for me, the way I look at it, I've only done this. This has been my life. That the kind of impact you can create in someone's life in healthcare is unmatched. And this was the opportunity where everybody in the healthcare industry was able to fulfill their purpose, their sense of, wanting to be accounted for. And I must say, I'm truly proud of the team, that everybody in my team put their hand up and they said, yes, we want to contribute, we want to make a difference, and no better opportunity. So I think connecting people to a common purpose was, a great opportunity for us. I think Joy covered this also, that thinking on your feet was the need of the hour. You had to think on your feet. So what we did is we used the concept of what we called as inclusive leadership. That you empower your team, you give them that, sense of ownership, and you have a collective wisdom. So I've always believed in inclusive leadership. So that was a, huge learning for us, that how any problem can be solved if you have that concept of inclusive leadership. And last but not the least, I think in your, your animation that you showed, Joy also touched upon that. You spoke about it, that I have never called anybody a vendor. So two words that I don't like, one is employee and one is vendor. They are not part of my dictionary. Everybody is a team member or a colleague, and everybody is a business partner. I don't like that word vendor at all. So I think that is what showed up. Relationships truly matter, Krishnan. I can't tell you the importance of that. And George, who is our head of procurement, who's part of this program today, George and I have, thrived on relationships. And truly what stood us at this point of time was the relationships that we had in the industry. Because when there was a lockdown, we were not even allowed to move out of our, labs, but, through our relationships with the BMC, through our relationships with our channel partners, we managed to get PPEs for every person. So I think first was to get the PPEs. And as Joy said, to make sure those PPEs are authentic. But that's where relationships truly matter. So the bottom line for me has always been and will always remain is, the importance on relationships and partnerships. This is a partnership. This cannot be done single-handedly. So these were some of my key learnings, in the first few days.
And I'm glad, Doc, if I just to do a quick synopsis of what your learnings are. I mean, I love the fact that you are absolutely right. India did not give its due credit to diagnostics for a long time. And I think, unfortunately, the pandemic actually brought it into the spotlight. But glad it is happening, because we as a country, if we understand wellness, then diagnostics is here to stay. Everything else will follow automatically. Right. It will fall in place. So it's not that, surgery will go out of the fashion, nothing of that sort. But wellness is a key to a healthy country. So I think diagnostics has achieved that status today. And I'm glad you talk about, and this is where I find the difference between, an entrepreneur. So you have actually spoken like a true entrepreneur with pride, common purpose, and how nimble-footedness, helps you in terms of creating those inclusive leadership, empowering people, and helping them making those difficult decisions on the feet, rather than having them to, scuttle around with bureaucracy, which can possibly, slow them down. And also, the best part is, how do you also build relationship in the crisis, which is very important. This is tough times. There are chances. It is the very old example by a gentleman called Prakash Iyer. If you follow him, there's an example of hot tea bag. He says that the best color of the tea is when the tea is dipped in the hot water. So that's where you reveal your true colors. So stress, crisis also reveals everybody's colors. And I'm glad your organization is able to, discover a common purpose and, a common leader who can rally them around into these things. So with this, I think let me quickly move to none other than Dr. Sarjan. Sir, your take, and I know I've been conversing with you over the last 9 months on a regular basis, but I'm not going to guess any of the answers. I'll let you answer that.
Can you see me?
Yes, I can hear you, sir. Please go ahead.
Krishnan, thank you so much. It's been a learning for me also. After these two great legends who have spoken, if Joy is the Virat Kohli, obviously Sir is Sunil Gavaskar, Sachin Tendulkar in one. And I must appreciate the learning today, which I had to not use the word vendor, and it basically to use a word which is not partnership. Thank you, sir, for the same. Our learnings have been more of the same. We can see it has been almost the same as what that has been, but there was a difference in our situation. So I would like to tell about our situation, what it was. So March, if we say, I start with the pre-COVID thing, February, March, we start getting news about COVID coming in. At the same time, the news also came in about API being in short supply, especially from China. And since most of the things are produced in China, we were a little worried on that. So as intelligent people would do, and we thought we were the Doordarshis, so we stocked supplies for 3 months. And that's what we did. And then there was a double whammy. So also we were intelligent enough to at least stock for disposables and PPEs for 2 months, looking at the COVID scenario. At least we started early. But the bigger problem was a double whammy, because we had 3 months stock of inventory and inventory, negative inventory went on to 65% with non-COVID patients not coming into the system. So we had this initially as a pre-COVID thing. Then the issue was, how do we sort it out? So obviously it's like a partnership with the people who are supplying us things. I purposely don't call them vendors now. Our relationship which helped us. At the same time, unfortunately, we had a CMC which was coming up as we have finished 5 years of all the equipments. Again, the relationship with the team worked out, and the key to all these things is building good relationships where we could push the CMCs to 6 months down the line on the basis of COVID. All the help happened, and we could save around an amount of 3 crores in only CMC. During the COVID, it was a war. It was a war footing. Everything. We were also the one of the labs which got the permission to do RT-PCR, but again the reagents cost and everything was a real challenge. Only one thing we did, we created a team which was meeting every day to talk out, and there was a bigger team of which was meeting every week. So there were 2 tiers of team, right on the ground and one at the back, which was looking at the situations and trying to work out. If you come to the 2 challenges that we had was remdesivir and tocilizumab. Obviously, that was a challenge which was only could have been done by relationships. Nothing else was matter because it was something which was not in the hands of the hospitals or anybody. But one learning which we had here was, since we had this COVID coming, it was an inclusive management meeting with the doctors. What is the line of treatment going to be and what they are going to do? Selection of patients. So that also helped us in making them aware what the challenges the supply chain is doing. What the challenges supply chain was facing, and the doctors were on the same format as we are. So that helped us in that. And finally, after the COVID, pre-COVID, post-COVID situation has come in where we are again back to normal. But some of the learnings which we got is very clearly is get the formulary in place, right? And get a very strong things into place, get the formulary, talk to the doctors, and nothing beyond the formulary has to be used. That is one learning, tight formulary. In the COVID situation, the problem was the treatments were going left, right, center. There was not a clear-cut protocol what to treat. We started with Toxi, we went to remdesivir, we went to all the Fabiflu. So unless the clinicians come into the perspective, the supply chain can't do anything. So the clinician has to be brought on board and said, this is what we want. And finally, post-COVID, one of the things which we have learned and which we are introducing into the system now is something which is known as auction, reverse auction or price discovery, where we work with our partners, allow them to
hold this thought and maybe talk about this in your.
Yeah,
it's a beautiful thought.
So these were the things that we learned. It was a pure learning for us, and and that's what the whole thing is. The only thing was getting the team together, daily briefings, daily meeting, and on the toes all the time. Thank you, Krishna.
So glad, Dr. Nair. I think what I could sense here is, again, the same keywords. Agility is clearly there, and inventory management. I think supply chain has become really, really important. And I have to give you another example, which I always love. Most shared functions in organizations, and especially the limelight is taken away by the people who front the customers or patients in some form. But and the beautiful example that I always remember about supply chain is, imagine we are all in peak summer and it's about 50 degrees. And imagine we are all in Rajasthan sitting right now, and you have a nice air conditioner in your room, and you suddenly realize the air conditioner is off. The kind of status that you will feel is exactly what supply chain disruptions can actually make you feel at times of crisis. So, what an air conditioner does is it's a lot of comfort. Sometimes it's a very thankless job, unfortunately, if I may say so. So the entire supply chain community does a lot of things in silence. The air is coming, beautiful, but nobody knows how it is working. How is the device reaching its table? So maybe this crisis has sort of brought some focus on this part. So with that, I'll quickly move to Muruganathan Saab. Sir, you have seen it from a large 50,000 corporate hospital feed. Your view must be very different. How do you describe the past few months and what's changed?
Thank you, Krishnan. Most of the points which I thought of talking have been covered by all the earlier panelists.
Quite possible.
Nevertheless, our setup, as you know, we run hospital across country. So when we heard about the stressful situation coming up, what we did first thing was taken stock of the situation, had a lot of virtual meetings with all major players, partners. I would say, as Dr. Sanjay said, henceforth I'll stop using the word vendor. I frequently use that word, but I'll try to restrict. Okay. We started discussing with partners, asked for their help. We worked on in two sets, basically like one related to COVID related materials, one related to regular materials. We looked at things and then charted out our inventory basically. Like we said, like, usually we pay like, in 45 days for supplies, very well. We did discuss with the partners and we gave promise like part of the supplies we paid upfront actually. And part of the supplies we requested them to keep with them, not to deliver it to us. Second part, what we did was like earlier it was on silo, like the inventory, though we had visibility at 7 different servers for all 50 hospitals, 50 plus hospitals. We immediately interacted with our IT, integrated that and had created a tracker system, particularly for COVID related items, linked with COVID patient occupancy and usage actually. And we were monitoring it on daily basis. In the sense like morning, first off, we spent about 1 hour across group, all our team heads actually, review the stock movements, consumptions, and the availability with the vendors actually. This is what we did first actually. And second, it's not just the consumables. The second part was onto the equipment which were required, both to run the diagnostic service, because almost more than 12 diagnostic centers of ours got approval in the first stage itself to do the COVID screening test. And all our hospitals like started allocating beds for COVID patients. So what we did, we looked at equipment requirement and we pulled in the total data and started relocating to the place where it is required. All metros where we were treating COVID patients, we have upfront mobilized the equipment before real lockdown came in place actually. And the learning what we all have got it is like as a group of hospitals running centralized purchase for a long time and depending more on MNCs actually, what we realized or what we have learned is like we have to have the local players with us on board actually for all our requirements. So the second phase, what we did during COVID period, when the load on the regular procurement was very less, other than the stressful activity of arranging materials for COVID related requirement, what we did, we formulated different teams to work on alternatives which are available locally, which can come with shorter lead time. We started interacting with those partners, started having agreement with them. So at the end of the day, like what we realized was like global procurement is good for a normal period, but we should have local support to run during crises like this. Earlier crises like during trade war or financial meltdown or any sectional disturbance in the international area, we were able to source it from other areas. When China was in problem, we were able to take it from other parts of the world actually. When Europe had problem, we were able to source it from US. But this time, unfortunately, like total global supply chain came to a halt. And even when materials were there, they were not able to, or the stocks were there, either in US or in Europe or in China, because of various political conditions as well as the restrictions posed by the government, we were not able to mobilize those stock into the country. because of our pre-planning, we were able to manage. Touch wood, we have not had any stockout situations across our group to manage our requirement. The main learning, other than being flexible, being the relationship point, the main point what we look at is like we have to move towards local procurement strategies. Then the other point which we realized was like it's not just the relationship, the contractual agreements with partners, it's the human asset who are involved in SEM. Let it be in the hospital side or in the supply source side, actually. They are the key players who have helped us. We had situations where midnight the doors were open, moved through ambulances to various sites, and as well from our own hospitals from Bangalore to Kolkata to Bhubaneswar, Bilaspur, even to Mumbai. We were using those, I would say, COVID heroes, though they were not in the front line in front of patients. They have put them into risk, and they have helped us both from supply source side as well as from the hospital side. I
Great.
take this opportunity to thank them, particularly the human part of it, which all along we were not giving much importance. And as well, like generally, when you look at any supply chain system, it was a cost center or a back-end support service. This COVID has brought in a situation where everyone, top to bottom, everyone realized that the SEM is going to be the business driver in such situations.
Absolutely. I think well put, sir. You just reminded me of how our teams personally also had to go into ambulances to deliver goods to certain places. Some patients were calling out, urgent surgery. So I think what I pick up is two clear points. One is real-time assessment. I love the fact that in times of crisis, your team was up and doing real-time data-based allocation of resources, which is also what I think Sajan Najar Sahib alluded to. Getting your formulary right in terms of what is stress and what is, as his business. Also, the fact that you're moving, you're distributing your supply chain risks between global and local. Is there a way in legal language, it's called the fungibility test. If there is an alternative, look for it, right? So I'm glad that's also happening. And in the next session, we'll also cover more elements of it. So I don't want to give it away. I'll quickly move to Madan Saab. Madan Saab, possibly first pandemic for all of us, and for you, a first-time challenge coming into a large hospital, handling such a large role. How was it? What were the learnings like?
Sure. Thank you, Krish. So I will just touch upon a couple of points before I get into my learning. Right. So first, I don't know if it's a good thing or bad. This is not my first pandemic in my professional experience. Right? When you work in automobile industry, that is what you hope to see every time.
Yeah.
So the only difference what I see with COVID is I call this like the mother of pandemic. Right? It touched upon all the industries, irrespective of what you do, where you are across the globe. So this is one of experience for each and every one of us. So before I go into the learning, just to answer Dr. Arora on his question, what is the reason I moved into healthcare? Because after spending almost 15 years in automobile manufacturing, the answer was in your response itself, is the purpose, right? The main purpose is to give back to the function where I'm currently working, because if you look at automobile or manufacturing, the purchase function is much more advanced in terms of tools and methods what they use. So I've been a trainer for one of the largest company in the world. It's Michelin Tires, where I was based in France. I was training all the managers in terms of purchase tools and methods. And when I moved back to India, when I looked into industry, there are certain industries which require more of a strategic approach than doing a transactional business. Looking at the future, what healthcare has in India, it needs a lot more than what it has today in terms of process and tools to adopt to the future mode of business what they have in pipeline. And the second purpose is it's again, it was there in your answer in terms of fulfillment, because I think Muruganandan will accept me. Every penny you negotiate in terms of implants, right? Directly it reflects on your patient's bill. So that really, end of the day, when we have long hours and long days, working day and night during the last 1 year, that gives a sense of satisfaction. Okay, I used to get calls from my hospitals in Hyderabad. Okay, we have few patients struggling in ICU. I need some remdesivir. We don't have it, or other drugs. So we have to call even at 11 or 12 to companies to see, even if I can get one single vial, right, that's going to save a person there. So these are the things. Main reason why I would say I moved into healthcare. Coming to the learnings, what I had, obviously, I had all my peers who briefed on what has been done in the healthcare industry. So nothing new that Aster DM has to do, because it's a small industry. We all know each other. We try to either take it from the best practice, what is happening. So again, I saw my name in the end. I don't want to give the excuse of, okay, everyone has said everything. So main reason is what I can say in terms of learning is being proactive, right? Uh, so not only being agile, but also being proactive. Today, it's more like how we see in the cricket match. The moment someone hits a four, that'll be a fielder there. So he will find some other place to hit a four again. So we need to plan ourselves clearly on the way forward instead of waiting for the next pandemic to come and kick us. What we adopted is kind of different approaches for, let's say, cost containment or cash management, mainly in order to respond to the muted business performance, right? As we believe there is no one size fits all approach here. So everyone has to, depending on the size of the hospital, where your location is, the, because it happens so that we have most of our hospitals in Kerala region. And the first case came in Kerala, where I tried to source all the PPEs from Bangalore, and I had to push it in the ambulance. And on the border, we have our buddies who stop the ambulance, take away a few PPEs and masks. So we had to go through all those things, right? We had to show them as a dead body and move the ambulance to different locations within South India. Um, so for me, there are mainly two schools of thought regarding how business could plan for such unforeseen risk, right? One is you try to identify the risk that might happen, because however, had anybody been making up a list of all potential risk, I'm not sure whether they had this pandemic would have been there on the list or not. The other school of thought is to identify all the different things that might disturb supply. But companies don't need to go through that exercise, right? This is the difference between, I would say, other industries. If you see, automobile did not bleed much as what healthcare did. Even though there has been no sales for like almost 6 months, they still survive. I still see my old colleagues who are being promoted, who's got the appraisal. I'm like, I'm not even getting my salary here, right? So they have learned through the several disruptions what they had in the past. Mainly, one main reason is just take it as a given that something could disrupt your supply. The prevention is either keep a buffer stock in inventory or have multiple sources of supply geographically separated, or you could do both. But have the plan in place. Don't wait for something to happen in the future.
Okay.
So this is something that's the learning I would say I got from this.
Great. And Madan sir, by the way, it was not a design to put you at last. So just a disclaimer. It happens to be you're the youngest, but it was never a design. But nevertheless, I think the stuff that I really loved about what you mentioned is, I think what automobile industry does not do. I think I personally also, Arora sir, I have spent about a decade in healthcare. But if I look at my overall experience, I think healthcare is by far the largest now. So I think it is a purpose. It is a purpose when you go home, you actually have a peaceful sleep that you actually helped somebody save somebody's life, And I think that's a great purpose to wake up with and, deliver with all sorts of energy. And Madan sir, in your speech, I think I picked up a quick element of cash management, I think, and one size does not fit all. So I know the next session would talk about it. We talked about risks. And I'm glad you're talking about strategic change in the way you look at healthcare, because pandemic is pandemic. It is here to stay. It'll come in some form or mean, swine flu or COVID, whatever. So I think if I have to sum up the session, a lot of great learnings, a lot of commonalities also. Some keywords are coming out there. But with that, I think I have to also be cognizant of the fact that I'm holding back a birthday member back. So I'm going to quickly go into the next session. We will keep the questions for the end. So the next session is about here and now, and what sort of actions all the supply chain folks who are watching this program are already in this cohort. They have learned something. How do they go back and implement certain things? So we have kept about 5 questions, and the way this will go is each panelist gets to speak about 3-4 minutes on that topic, and then we get the other panelists to sort of pitch in and throw in some of their own ideas on that particular topic. So I'm quickly going to Joy now. Joy, I know the question for you is, some of the panelists actually alluded to the fact about how do you do real-time management on supply chain, and so that comes to the question that, are there any good opportunities that you see in healthcare space on the digitization part? Can digitization play an important role in SCM and the way it is being looked at as a function? And do you see any change happening there? So Joy, over to you.
Thank you, Krishnan. And I'll say like this, that digitization is not only for the supply chain, probably it is applicable in all the functions of healthcare delivery. Unfortunately, I must say the penetration of digitization has little late in healthcare in comparison to other sectors, but nevertheless, we should be happy that this is happening.
Okay.
Overall, this can happen. So now, if you see, and I'm very happy that I'm sitting amongst so many supply chain people, professionals who are handling this straight away. But what should be the future vision for this supply chain? The first thing is, any decision has to be faster. So what I'm trying to do parallel with the overall healthcare delivery and the role of supply chain. It has to be faster. It has to be more flexible. It has to be more granular. So information, data, whatever you need, that needs to be in a more micro level to get your decision rolling. Then it has to be more efficient, effective. That means the decision what is taken, and some of the examples what has been given in terms of Apollo Chain's experience when they are multicentric, how they have acted, those are very much accurate and more efficient and effective, and very importantly accurate. Those days have gone when you are talking about your data, facts, figures without having those things technologically run through and giving the correct one. Then what it will lead to? It will lead to optimization of cost. How it will lead to optimization of cost? I'll tell you from my own example or experience of the hospital. I run certain inventory with a huge number, and I have those numbers spread over certain square feet, certain area. If I don't keep those things in a proper way, without having the right information with me, I am likely to lose good amount of money, because those inventory going to either expire, or I may not know, I may continue to order further and things like that. Then reducing unnecessary variation. I heard about the drug formulary point came up. So this is something again where we are very strong, not only today, for last several years, where in our inpatients we provide all the medicine to the patients, and we have a drug formulary which is spread over the hospital amongst the doctors, and they don't provide medicine, write any medication without referring. And if they write something outside that, then they are answerable to the governance system that why they are writing it. So data digitization can help it. Another is enhancing patient care, delivery, and engagement. This digitization in supply chain that can happen, that can help in a big way. And finally, I'll talk about the new value creation priorities. It has gone the earlier days, you pay money, get items, you buy the right items and give it. No, how do you create value? How do you improve your value chain? If you look at all this, then technology, digitizations are going to play very important role. So I will stop here.
Great, sir. So I think I'll just quickly go to the panelists here, and it's a open house for the panelists. If you want to input quickly in terms of anything that you feel can add to Joy's point, I mentioned about Apollo, the way they have done it real time. I think some elements that possibly Madan could talk about in terms of what practices we have in automobile industry that could possibly benefit digitization in this country. And between both the hospitals, Zydus and Aurora, sir, if you can input, have you done anything specific? Are there any softwares that you have inputted? So if somebody can, quickly come in and sort of input those points. I've given out some pointers, so feel free to please contribute.
So Krishnan, if I may go ahead, the
Yes,
point is that we all corporate hospitals have been at an advantage. I know most of your participants are coming from smaller cities, or they are CEOs of hospitals in 2-tier or 3-tier hospitals. That's what my understanding of the whole group is. Now, we do have a benefit of having a lot of support systems in our systems. But like what Joy said, the digitization, we all have our digitizations, EMR records in place. We have got HIS systems in place. But foremost and most important is that you get your formulary in place. And that's what we all insist on, getting a formulary in place, whether COVID pandemic comes next or not, but we have to work regularly on a routine manner. So unless you get a proper formulary, and the most important thing is the buy-in by the doctors as well as the pharma guys, right, as a supply chain. I have one thing I wanted to tell these guys, or which I believe is, uh, any purchase guy or any store guy has to actually spend some 1 or 2 days into the wards or ICUs to understand what work they bring into the to sensitization. Ki they're buying of medicines or they're giving medicines in TAD makes a difference to the patient. Once you get it sensitization, then you move on to the other things. So once the purpose is solved, then they get moisture to create a difference. So we have a lot of things. One thing which I was thinking, if companies like Merrill, sorry, I am getting into that, if they can get all the teams, small hospitals together and work out a common digital platform for them to work out on the formularies, it would be a great help to those people, and it will make a difference in inventory control as well as the cost and the profiteering by profit of the patient. That's just a point.
Sure. I think we
I
are
think Krishnan,
looking
maybe
towards yeah, please,
I can
sir.
add to that, Krishnan. I think what I liked what Mr. Sajan said about, that while digitization is, I think, a given today, real-time visibility, what connected me also, and that's the way we operate, is that the supply chain team needs to know what happens behind the scene. How is that material going to be used? So our team actually works very closely with the lab to know how the consumption will happen. So, if there is a in-depth understanding of the process that happens behind the scene, there's a lot better optimization of the material. Yeah, instead of just doing it mechanically. So I think
Okay.
that point I can just echo on that point of his completely.
You're saying bring in some amount of human IQ to also interface with the so-called mechanical or digitization of the process.
I'm saying if there is an understanding by the team on how that material actually is going to be used or consumed, I think that no software will be able to bring,
Yeah.
unfortunately. You'll need to do
The
that
knowledge,
yourself.
the knowledge of the real-time process is also very
Yeah,
important before you
yeah,
actually
yeah,
undertake only
yeah.
a sort of a digitization process where it is garbage in, garbage out if you don't understand what the data is.
It
So
is
Madan Saab and sorry, yes,
it
Sajid.
is moving from the IQ to EQ. You have to get the emotional quotient in place.
So between so Muruganathan Saab, or you are already smiling. Any other points that you want to add? I think I love the point.
Just to add on, just to give what we have done here, like even pre-COVID period when we were normal, we worked on integrating with the supply chain, the supply source software actually with a couple of companies, wherein
Is it okay if you can name somebody? I mean, if people can sort of go out and shop for them.
we have worked with Medtronic, we have worked with Siemens, and integrating our software with their thing with intermediate software, wherein we have given some level of visibility of stock movement to them. As you know, we have contractual systems, they have contracts, and we have formulary in place for most of the medical devices as well as for pharma item. And I'm more connected to the medical devices, not to the pharma area, as you know. With respect to medical devices, what we have done is we have given the visibility to them actually.
Okay.
As and when an item is picked up and gets consumed, they get a trigger actually. That's how we have worked on it. It's in an initial phase with only with couple of companies. We
will
are
be
planning
happy to partner on that. I mean, honestly,
we are planning to move with most of the supply communities. One, if they have their own well-established software, we want to incorporate interface our software with them. In case if they don't have, want to give an access to our software wherein they're able to see the stocks, what they have been supplying to us, and for which they have contracts with them actually.
Brilliant.
How it helps me is I don't need to monitor. To some extent, they will monitor and they'll arrange for the replenishment actually. Looking at auto mode, having said that, this COVID pandemic has given a lot of insight into the importance of SEM human asset. Yes, I can't just leave it to the data. We have to look at the data and do interventions more frequently.
Sure, sir. I think, Madan Saab, in your case, your own learnings have you brought any learnings on the digitization side to your current role from your previous experiences?
Sure, Krish. So to start with, right, when you want to do something, when you want to digitize something, you need to have data in place, right?
Yeah.
Unless you feed in the data, the system is going to blink at you. So what is important is to derive the data, at least create a process to ensure that you will get the data in the future. Right? As what Dr. Sarjan said, we need to have the item master creation. You need to have the formulary done. You need to know your consumption pattern, right? Unless you have your demand forecast completed, how can you create a supply relationship management? Your partner does not know how much you're going to order next month. So unless you have a clarity based on your last year consumption, you derive at each and every item. You tell them this is going to be my forecast for the next quarter. There is a preparedness from your partner side where they will make sure, okay, for this hospital, this group, this is what my requirement is. After that, you can put in all the tools in place to digitize everything. But today, in most of the hospitals, I would say, except for the top ones where we have the tools and the systems in place, most of the hospitals in India, they need to get their data clarity first. Have the item master created, have the service master created, have the formulary in place, what you're going to buy within the formulary, have the brand share clearly segregated, what items, and if it's going to be for ICU, you need to have an innovator. If not, for all the insurance, you need to have this kind of item. You need to have clarity on those aspects, right? So we have done that in the last 10 months, not only for India, for all the countries where Aster is doing. So for all the hospitals together, we created the item master, we created the service master, we have completed the formulary with the Group Medical Supplies Council, where we have the PTC committee from all the CMSs, all the consultants are part of the committee to decide what formulary they want. So we go challenge them. This is the price what we get. We want to reduce the expense here. We don't care about how much we sell it for. So we are pushing more to reduce the overall spend, right? It's the intention today is not to increase your spend. Your material spend in the panel has to decrease so that you have visibility on the overall items, what brand you use. So coming back to digitization, what have been done recently is I've been discussing with few partners for the AI bots. where they can plug in the bots into your system that can create the purchase orders, send it to your supplier, send it for approvals, which can optimize further on the resource, right? So this is something which is already in place. Right now, we also have the diagnostic chain opened in March in Bangalore,
Yeah.
the Master Labs, where we are also working with all the partners to see how we can bring in more efficiency in terms of having a end-to-end supply chain because of creating satellite labs across South India, right? So you need to have the material flow aligned, what material goes where. We have a centralized purchasing there. So I'm working with the team to create overall structure on how we can define the digitization as part of the supply chain, but not overtake the entire process.
Understand. I think brilliant
That's it.
points, Madan Saab. Well put that without data, there is no digitization. You can have digitization, but if you don't know how to decipher it, it is worthless. So with that, I think we'll quickly, come to the end of this panel discussion. We will, as I said, take questions last. So a lot of keywords again here, and I'm glad, Dr. Sajan, he's a chief operating officer. He seems to be having some ideas about all the pieces of what he does. And that's the reason we always bring him on the panel. But at the same time, I'm actually seeing procurement and supply chain move into the other side and also look at demand and discussions with doctors, which is very, very uncanny. Possibly the crisis has made you do that. And I thought even Sanjay Arora Sahab alluded to that in his opening remarks, that how do you sort of partner and look at demand end to end, which is not only one end of the value chain, but the entire end of the value chain. So thank you, gentlemen. I've had Joy Chakravarti silently moving out for his birthday with his family. So I actually did a thumbs up. Unfortunately, I couldn't stop the speakers, but we thank him for his presence. So let's quickly move to the second sort of question. And this is actually put at Dr. Sanjay Arora. Demand certainty and material availability. You are seeing there is COVID test wanted, but demand is not there. Sometimes reagents are not happening. You have machines which are supposed to be serviced, machines conking off, and so much of uncertainty. You, as a founder and somebody who's at the helm of affairs as a promoter, apart from being the general manager of your company, how do you see this piece? And what sort of advice would you want to give people here from here and now in terms of your expectations from the supply chain team as a whole? So
I think a little bit of that I already spoke in the beginning, that when we started, we were doing about maybe 50 to 100 tests a day, and there was all guesswork that how many tests will we actually end up doing in a day over a period of time. And our COO was very confident that he's saying, "Doc, 2000 seems like a real number." I said, "Sushant, are you sure? 2000 on what basis?" So what we did is we set up, like I said, that war room concept where every stakeholder who was part of demand generation was, and we had an Excel sheet. That was the easiest way for us to do it. And we asked Krishnan, okay, how many samples are you going to bring today? George, how many are you bringing? And we asked everybody to, on a daily basis, to actually tell us how many samples they're getting.
okay.
And you won't believe, Krishna, we started at 150 samples, 150 samples. We peaked close to 5,000 samples a day. And that perhaps was the biggest learning for us, that how did we move from 100 to 150 tests a day to 5,000 tests a day, from having one lab with 1,000 square feet to make it actually 3 labs with 3,000 square feet in real time without a single day of shutting down. And moving from a 12-hour shift to a 24-hour shift, moving from a team that was only 10, 12 people to about 60 people. All this happened sort of, it's like on the go. It's like you're trying to repair a car, but the motor is still running. It's something like that,
Wiring the house without shutting it down, huh?
Yeah. So I think, as I said, the biggest input for us was being inclusive, getting people, to share their thoughts or demands or expectations every day upfront. And then George and his team would sort of, based on the inputs that they were getting, work with our partners to see how we could, but it was not always a perfect situation. We had one time where a consignment, which was unfortunately from China, was held up because of political reasons at a warehouse. And we literally had to plead with the politicians. There was one particular consignment, and I'll tell you how sometimes we found people, the public private coming together, at least in our state, Maharashtra. Uh, the plane was not allowed to land. So we had to speak to the health minister who actually facilitated the plane with the consignment to land in Mumbai, and we could get the kits directly from the airport. So I guess when the going gets tough, you find ways to do this. So I guess India is known for its jugaad, and that's what we actually did. And we found that sometimes you need to do jugaad. You can't do anything without jugaad. Uh, but I must confess that there were times when we had sleepless nights, but we did not shut down operations even for a single day. Uh, we moved from manual extraction to automated extraction, and that's again where our relationship with our partners just came to use. I mean, just came to the forefront. All of us have some relationship with some partner, and everybody said, okay, we can provide this, we can supply this, we can do this, we can do that. And collectively, we were able to move, like I said, from 150 tests to 4,500, 5,000 tests. And we made 3 labs out of 1, and that was perhaps the biggest achievement for us today. So it was all about, just getting people together, collective, inclusive leadership, getting that collective wisdom, and of course a little bit of
So
jugaad.
going forward, with the way I hear you is, if I paraphrase that, this is your point that going forward, partnerships are key to also, and apart from the ground level, macro level, micro level planning that you did in terms of per person, in terms of how they bring in samples and so on and so forth.
Yes.
You plan to continue that, or is there any change in the process that you're bringing in?
So what happens is, we also saw that certain channels, we were getting a lot of samples from BMC camps. Now today, BMC camps actually are practically nil. But at the same time, we are seeing a lot of samples coming from the travel agencies or the travel channels. So we've actually put up a lab at the airport now. So where one channel stops, another channel. Now we got an unusual request the other day that I am going for a wedding. So the entire wedding party needed to be checked before they travel. So they want to make sure that, So
this is interesting.
Entire 100 members of the wedding party, the event planner came to us and said, can you do this? And that's how. So, things keep evolving. I think it's all about creating the network, creating your relationships, creating your connections. For us, it's still at that level where we're working on a human interface, because we're unable to predict how the demand goes. Today, I think we are looking at the opportunity where just this morning we saw that India crossed 1 crore number of COVID positive cases, but I think the actual number of cases will be maybe 6-7 times that. And what we are also seeing is that about 50% of the antibody tests that we are doing are positive.
Oh.
So it shows that there's a large amount of, at least in the urban areas where we service, maybe 50-60% of the population has already been infected. I know many cases who have never felt that they had any illness, and they are antibody positive. So I think that, January will be a month of transition.
Okay.
From February, I think vaccines will probably take more importance. And I feel from April onward, we will see a decline in the volumes of COVID. So that's my prediction.
I think that's a great insight. Thank you. I think this is exactly where I was alluding to. In terms of, today, all the people, when they go back, they have to start thinking, is this demand for there, or is it some sort of a bubble? So I'll just quickly, move to the other panel. Oh, Sajan sir, you're raising your hand. Go ahead, please.
Krish, just since Arora was telling about, wanted to understand this, since it's a supply chain program. See, the RT-PCR started at 4,500, and the vendors were giving it 2,000 rupees, whatever it is. As the reduced price went down and down, today we are getting the reagent in 100 rupees. The same test. And so there is something called the government interference or government positivity, which is working here, where there subsequently, as you reduce, it's a very strange thing, which we don't know whether we have a role or not. It is an external influence. But the same RT-PCR which we were buying, reagent by buying at 700, 800 rupees now cost hardly 100 rupees. So it's not that the company has changed, it's just that the demand and supply which has changed. And we as supply chain persons, we need to be more on the every day on the dynamics, what is happening. That's where the whole thing comes up.
So I think dynamism is the key word that I could pick up from you. So Madan Saab, anything from your side? You've just started your pharmacies. Do you sort of see the same thing, or have you changed anything at your size to, manage the uncertainty in demand, so to say?
No, there's always uncertainty, and it's going to last for some more time, right? Initially, we were talking about the PPEs, then we talked about the remdesivir. Now we're going to talk about the vaccines. So for the next, I would say, 8 to 10 months at least, this entire year we're going to run behind something or other. So at least we get experience of the PPEs and remdesivir. Now for the vaccine, we don't. I already see that Apollo has tuned up their supply chain to have at least 1 million vaccine catered today. So everyone has to work on that aspect instead of waiting till the vaccine comes out and then run behind the strategy on what is to be done, right? So that, as I said, we just need to define what is important for us, whether we are going to focus on that particular area, and create your strategy accordingly.
So preparedness, prioritize is something that you're clearly articulating. I think what the pandemic this time has taught humanity is whatever you do, preparedness is the key to whatever you do in terms of managing any uncertainty. Muruganathan sir, any inputs, quick inputs from your side?
It's as they all said, like preparedness. That's one part, and the quick decision, like. When we had approval for 12 labs, other labs in tier 2 cities have started asking for similar facilities. They went for approval actually. If you work on the financials of it post-COVID, okay, we all know that this will last for some period. After that, what will happen to the investment? So
Yeah.
that's where the decisions and the strategic decisions come into play. What we decided and what the management gave clearance was, like, once the demand comes down for COVID screening, we can remobilize those facilities to other centers or for other purposes.
Great.
In the same center. Earlier, like as you all know, like molecular used to be a different field. Today,
Yes.
every lab, smaller or big, everyone started doing it actually.
Yes.
Otherwise, RT-PCR means, like, you have very select individuals who can claim that they can do that actually.
They can do it. Yeah.
Today, this COVID has changed that situation, and we have a lot of people who got involved, who got exposed to the new technology, got trained either on board or prayer, and they have started using it. So the fast decision and strategic decisions in such pandemic situation or any supply chain disturbance situation is the key one which we all have to look at it.
I think the way I pick up a couple of points from your side is when you say strategic decisions, I think you're actually saying that the prudence is very important. Whatever cash you want to deploy when you in terms of crisis should not go waste, and you have to find opportunities where you still leverage that, so that end of the day when the demand goes down, you're not in a place that, what do I do with this sort of sunk cost. Second, I am glad you picked up the point of training, that we as individuals, human beings, also have to train ourselves for certain uncertainties that might come. And for supply chain, I think this is probably one of the biggest tests for whoever has done anything in their lives. Very, very tough. So I think great points. Let me quickly further go to the third sort of question, because we're running out of time and it's very passionate discussions we are having. So I think the point is very simple here, and I want to go to Dr. Sajan Nair. I just touched upon the cash management and other elements. You have been running a very, very successful setup. You have managed to change the way Ahmedabad and the peripheries of Rajkot actually start thinking about healthcare. I'm sure you have a very, very strong financial metrics. So my question to you, sir, would be, when you look at supply chain and overall ops, how does supply chain contribute to the overall ops and ensure that they give positive cash flows? A. Second, any financial matrices that you have discovered in the past 8-9 months, which you are not doing, and you want to sort of give it out to people saying that, okay, I think you should practice this. Over to you, sir.
Thanks, Krishnan. Okay. Before that, there was some learning which I wanted to share with you of this COVID.
Please.
But I learned this: can never trust the Western literature and the research. And for Indian country, let's have our own research, own data. Because we moved from drug to drug, and then finally we have landed with ivermectin and doxy or whatever. So that's one thing to look at our own data. And so that comes to us to look at our own hospital's data also, right? We had a lot of learnings on, we finally had a formulary, but we tightened the formulary. We put the ownership, in fact, we call it as belonging to the doctors for them to decide. Simple, clear cut, 2 brands, nothing more than that. Now, there was a question which somebody had asked if we are having a problem with Ayushman. Now, I run 2 hospitals. One hospital doesn't believe in any schemes, no CGHS, no Ayushman, no GIPSA. So there we are very clear, the best of the brands come into place, but obviously at our cost, at our price. Original molecules may be allowed for the purpose they serve. There are hardly some original molecules which are still good in use. As far as Ayushman, it was, you have got a list of organisms or list of companies which give decently good quality control drugs. You can select from there. And there, obviously the doctors can't ask for something from multinationals like Pfizer and other things. That doesn't make sense. So it is ultimately the belonging and the ownership of the doctors who have been to part of your structure. As far as the whole planning is concerned, we did do a lot of research. We burnt a lot of our fingers, and actually हम लोग मुंह के बल गिरे भी. But finally we came out with 2 things. One thing is something which we call as a price discovery or auction, reverse auction, where we open up the window, we get all the not the vendors. Sorry, sir, I'm not using the word vendor. All our partners on the same forum. We open the window for 2 hours, and where our drugs are selected. The top 200 drugs from companies are selected, so they have to quote. Finally, somebody which gives us the lowest quote gets the order, and he has to supply. This has come in very handy. We have saved a lot of money from this thing. The cost price at which we are buying the drugs has come down drastically, even less than the rate contract that has been offered by the companies. Second, at the same time, we have taken out like renal sciences, all the drugs from the same company. So that then we have got a more bargaining power. At the end, Krishnan, if you look at it's all about common sense. The fastest moving and the highest revenue generating, if you look at, there are only 200 drugs. The rest are all very slow moving or non-moving, right? You play around, get them in place, work out a system, and you definitely are on. That is all we need to do. It's nothing beyond rocket science that we need to do these things. So work on your major drugs, major devices, or major things which you are buying, surgical items. Get the doctors on board, work out a cost, do a price auction, price discovery, and you are through. While we do price discovery and auction, we also start having the relationship with the participants. So they get connected with us on the vendor grading ABC. So that also works very well. So overall, it has been a good learning. We have made a difference, and I think we hope to continue on this. Thank you so much.
Glad. I mean, many points touched upon. I'm going to quickly open the floor to the panelists. Do they want to add from any specific financial metrics, and especially the founder side? I'm really keen to see, any financial metrics that you want the SCM folks to sort of learn, any, I don't want to call it a jargon, but any science that you feel they should know always.
So I think, for us, material is number 2 on our cost list, so there is a lot of focus on material, and one area that we look at separately is wastage. While we look at procurement pricing, we also look at wastage, because sometimes if you are not able to consume the material and or for whatever reason, so wastage becomes a big and retesting, repeat testing, all those areas add to what we call as wastage. So for us, wastage is a big metric for us that we measure. Besides,
you actually look at the bad cost of waste to sort of optimize it.
Yeah.
Great.
Yeah.
Yes. Yeah. Okay. Great.
One of the metrics which our supply chain guys, I think I don't know what your participants are, but there has to be a clarity in the store, the owner of the store and the owner of the buying. purchase, and this is something which is very common sense. Usually, because they are small hospitals, they have the same guy, but at least there should be two different persons responsible for the store as well as the purchase. Whether you track the business metrics or not, but you can always track purchase request to purchase order to GRN. And one thing which you can, when sir talked about wastage, GRN is at the level at which we can refuse or you can take out the wastage and see what is happening. So if you can follow these matrices, it makes a lot of difference in your data analysis and seeing where we are going.
Okay, great. Muruganathan Sahab has already unmuted. Sir, you want to say something?
Yeah. There are preferences and the usage patterns varies between the physicians and surgeons. Any procedure, not necessarily the COVID-related thing like the general procedures, elective surgeries. X surgeon does with certain amount of material. Y surgeon does with certain different set of materials. And a group like us, where we have physicians encouraged across the country, their practices varies. Balancing them is the main activity which stores and purchase guys should take care. Actually, we can't just leave it that so and so surgeons have asked for it, so we are arranging it. Actually, it has to go under standard system, and it should be part of your whatever library or approved formulary which you make. Actually, the standardization, yes, you can give choices, but choice list should not be so long for a group like us. But standalone hospitals, it can be managed very well because the physician preferences might not vary how it varies in group of hospitals or bigger hospital setups.
What you're saying is the number of surgeons or the number of clinicians actually is proportional to the number of choices, and largely in a larger group, the power of N is fairly large compared to a smaller one where it is still feasible and manageable. Okay, maybe that. So statistically, yes, it makes a very relevant point. Madan Sahab, what has been your experience in this case of are there any financial metrics that you personally look for on a day-on-day basis? It's like a wake-up call,
Yeah, of course, the finance and procurement work alongside, right? In terms of cash management, when I initially said, even today we have issues with the gloves where there are more than 20 manufacturers in Malaysia who have shut down their factories, where we want to have additional inventory in place. So my first guy to go for is my CFO. I had to discuss with him in terms of the cash management. How do we do? What do we do in terms of the capex procurement, which was put on hold in the last months, the new projects that were put on hold? How do we manage the vendors according? Because we don't want all the business partners to get impacted because of your decision, whatever you take, right? At the same time, the show must go on. You have to do your projects. You have to continue the business strategy, what you define for longer term. So yeah, cash management overall, the supply payments mainly, that has been a critical issue over the last few months, as Dr. Sarjan initially mentioned in terms of the AMC CMC cost, where you discuss with your strategic partners. Mostly we have the top 3 guys who supply you most of the equipments. You go back to them, understand how you can have a deferment of payment, how you can have a waiver in terms of the overall CMC charges for the year. So these are all the key things what we'll be focusing on.
I think great. I'm glad you mentioned on very important point that how SCM needs to work closely with your finance team, maybe on a day-on-day basis, which can also possibly help the situation because both start understanding and empathizing each other's situation and maybe come to a common purpose and a common solution. So maybe Sanjay or Asap's the point of teamwork is very critical of functions. How do we integrate with each other? Great point, sir. So I think lot of stuff covered here. We've already on 8 and we've got 2 more questions. So let me again accelerate to the next question. And this is my favorite question: procurement of medical devices. And one of the stalwarts who's done this for almost 29 years on a trot without a day of stop, and especially in pandemic, I'm sure he has done a variety of things. So Muruganathan sir, over to your views on this topic. How do you see this going forward from here? Is there something changing, or between the consumable or the capex, the way Madan articulated? What's your take on this?
First, I'll talk about capex thing. As like any other organization did, we also freeze the capex completely, except barring the upgrade of laboratories and the critical care equipment. Actually, rest all have been put on hold. Actually, so what our plan is going forward, major investment. We want to have partnership with the supply source. We want to explore various options rather than just procure and invest and procure the equipment. Actually, it can be revenue sharing model, it can be pay per use model, or it can be a rental model. These are the options we are looking at, which we have been doing it earlier also for institutes or our own units which are not financially strong, smaller units where the requirement is there, but financially they may not able to invest, because though it's a group of hospitals, we look at P&L of every individual hospitals. Actually, the capex plan going forward, we are looking at various strategies. One, deferred payment arrangements. Second, pay per use model. Third, revenue sharing model. Fourth, collaborative model wherein you make the users to pitch in to the investment, like the senior consultants, if they wanted a specific technology equipment, we can have a sort of arrangements with them. They also participate in the investment part. These are the various models we are looking at with respect to capex procurement. And as far as the consumable procurement going forward, as I pointed out earlier, our focus is more going to be acceptable import substitutes now. Actually, we have already started a lot of exercise in that line. Like we have mapped a lot of alternatives which are available in the market. We started working on evaluating those by various our physicians as well as the other users across our group, not necessarily from one single setup and take a call on it. We have started evaluating across our group. As you are aware, our CPU process itself is the selection of product is based on the ranking system which we follow. It's not like by a one single senior doctor who recommends. It's by the ranking which we get across our group. Going forward, not much changes would be there in the way we select the product and go ahead. The major change which we are looking at, or which we might propose to the management in a strong way, is trying to indigenously procure the possible quality medical devices. You all know, today, most of our medical devices are coming from outside. Actually, if you look at statistics, about 60 to 70% medical devices either in complete finished form or in the part of semi-finished form, it comes into the country. It's not getting manufactured in India. Whatever is available, if we collaborate with such partners, we feel like they will come up with new range of products which can help us in import substitutes. That's the major change we are looking at it. Hopefully, we should be able to
I'm glad
accelerate our plan in that line. Other one which we are looking at is, or rather, in one of our brainstorm session internally with our teammates, what came up was collaborate with supply sources and create production facility in the country, which looks good, and we have to seek good partners to look at, and we can partner them with them in their manufacturing activities. Basically, what they gain, the captive market, because our consumption is huge. The basic captive requirement code, whatever we have, the requirement we have, it goes as captive market to them. In addition, they can explore other selling out from India. Actually, These are the thought process we have. As we have to see how it gets materialized.
Add on one thing, we actually launched our initiative called Prayas, making Indian healthcare proud today, to this group from Merrill Endosurgery. So we are reaching out to many people because we have that capability. I'm glad one of that objective is already present with you. So somewhere down the line, strategically, we will get it right or wrong, time will tell. But at least from a move perspective, looks like we have made the right move. So thanks a lot for those quick insights, sir. I know, Dr.
Add on one more, like we in one of our discussions, it came up like I have touched upon this topic earlier also in a couple of other forums. It's like the absence of GPO in the country. As doctor pointed out, like we have a lot of audience from smaller setups. They may not have the power what bigger setups have or bigger lab chains has actually. There is something which comes up like a GPO in the country. Certainly, it will help the supply chain folks to have better
visibility
response from the supply sources actually.
Agreed. So, Dr. Sanjay Arora, I think you have a small commitment, is what I just got a ping. So, if it is that, really thank you. But if you can hold on and maybe stay for some time, it'll be good. But at this point in time, I just want to quickly take, in case you're leaving, thanks a lot for being part of this conversations, right? So, yeah.
I know, great conversations. Thank you for inviting me to be part of this, great panelists and, great learnings for me as well. I wish I could have, I didn't realize that, this will go on for a longer time. I mean, I can stay on for maybe 5 more minutes, but I'll have to excuse myself eventually. So,
sure. We understand that.
Yeah. So, thank you again, Krishnan, for inviting me. Thank you so much.
Sir, there is a question for you, sir, Dr. Arora, sir, from Mr.
Before you leave, yeah.
Before you leave, if you can.
How were you prepared? How we are prepared in the future if such pandemic comes? How fast can we diagnose in the future? Wow.
Great question. I think the kind of evolution in diagnostic technology is moving really fast. I think with the use of molecular and genetic testing, I definitely feel that our ability to, maybe be more predictive will definitely get better. Yeah, I mean, there was a joke, somebody in 2015 was asked, where do you see yourself 5 years from now? That person would have definitely failed in his answer.
Madan mentioned that partly, and I sort of associate with Madan's feeling in it.
So I hope we can, make that difference, that I think diagnostic testing is moving in the right direction with the use of newer technologies like both genetic testing and molecular testing, making it more evidence-based and, more personalized, more predictive. I think we are moving in the right direction, but difficult to answer that question really more accurately than that.
I think coming from someone who's been there, done that, I think it's a great ray of reassurance. Don't worry, if there is anything, Suburban is there to take care of you, at least in the western part of
Absolutely.
So Madan, I think if I can ask you the question that Muruganathan Saab left off, your own take, because you're already looking at other countries also. They are also facing the same pandemic in the Aster group. How do you see that piece sort of playing on when you look at the procurement? Are you seeing any difference in the way approaches, or are you seeing the same approach followed in both the markets?
No, as clearly what Murugan explained, we are looking at pay-per-use model, we are looking at revenue sharing model. Before that, what we did in the last few months is look at all the asset and check the asset utilization, right? So we always look at what we have to buy, but with the current market, whatever asset we have, unless you understand how much you're utilizing compared to what the asset can actually produce, you may not really know what you have in store. Again, looking at the overall asset tagging, what kind of asset you have, whether it's really needed for that particular hospital in that location, or can we do internal transfers? So those kind of aspects is what we are looking at. Mainly, also the collaboration with the main players. What kind of, in terms of innovation, in terms of strategy, we have to go beyond the capex model, where it need
Yeah.
not be even leasing or rental. It's more of other financial aspects what you're looking at, where it doesn't sit in your books, right? We have to look at the OPEX model. Again, OPEX model in a way where you don't have monthly fixed payment. So I think there are a lot of new ideas coming in from the partners as well. We have to give credit to them, because they are also looking at the market. They're looking at the sensitivity of the cash flow. They are coming back to us, giving ideas what we can essentially look at. In terms of, again, consumables, uh, I know where Murugan coming from in terms of GPO that is missing in India, because if you go anywhere outside India, if you go to US, you can't buy from anyone else. GPO is the only place where you can buy from, right? Uh, and that will help. That I wouldn't say that will help larger hospital groups, but for all the smaller groups, or the clinics, whatever there may be, it's a great opportunity for them to take leverage of the cost of the supply of the inventory. They don't have to hold too much of inventory when you're dealing with GPOs. But again, for larger groups where you have multiple hospitals, higher spend, I would say if GPOs are not coming
क्या
in.
फर्क कैसा आ रहा है?
Okay, I heard some voice.
नहीं,
So
इतना वैल्यू का डिफरेंस क्यों आ रहा है?
I think
It's
someone
okay.
has mute. It's fine.
Even I thought maybe something.
I've been looking at very strange comment for my record.
I also was taken aback. Itna change क्यों आ रहा है? So okay, then I realized it's
Yeah,
something else, not to do
someone was
with.
not happy with what I said. So
So on that note, I think it's a great panel conversation. I'm glad you picked up on a lot of financial elements here, asset utilization. And I'm actually, maybe sometime later, I'm going to call some of you and understand this whole thing about, what is the OPEX model which does not sit on the books. So I really need to understand this is how are you going to do it? Because as a partner, I am going to have sleepless nights of how to answer back my CFO that how am I going to send to these people without having anything on the books. So with that, I think let's move to the final sort of question. And sorry, Madan Saab, you being the youngest, we put you on the last, but again, it was not the idea. But there is a very important element that you have to, sort of tell us is risk. I think one of the elements that everybody in the supply chain workshop is worried about: risk of loss, risk of losing business, and so many other risks, including their own risk of, if the organization does not make money, how will they survive the whole scene going forward? So over to you, sir. If you can quickly talk about how do you look at the elements of risk from your own experience coming from various industries. Over to you, sir.
sure. So overall, when see, it's not a huge factor, right? Risk has to be contained in a manner that you should not look at that like a key element to do your business. It's everywhere. Even whether there's pandemic or not, risk is there in your day-to-day function, whatever you work on. Mainly being in healthcare industry, right? So what is supply chain risk? It's basically a situation that can potentially disrupt or delay the flow of the raw materials, the flow of products through a supply chain. That's all. Whether it's medical supplies, whether it's auto components, or whether it's any other raw material anyone has to deal with, that's the risk. So mainly this COVID-19, the pandemic has put a lot more focus on the supply chain risk management, and it has taken an increasing importance across the global supply chain worldwide, right? So when we talk about the pandemic, this is not the first major disruptor to global supply chains, and it won't be the last. But I have personally had experience when there was a devastating tsunami in Japan, which kept the auto industry reeling for months together, right? And the horrible flooding in Thailand. I was there in Thailand that time when this happened, right? And I was trying to source some parts, and we had that hugely affected the supply chain of many computer manufacturers dependent on hard disk and so on. So that has been always a learning. If you go talk to a Japanese about the earthquake, that's like a bread and butter for him. He does it every single day. So the same thing happens in some other country. It's a huge issue for them, right? Earthquakes doesn't happen everywhere. So we have to align ourselves, work and design our own function, our own industry in a way that in future, whatever come may be, we should be able to sustain it, right? So before you develop any risk mitigation strategies, what one must first understand how your suppliers were affected by the pandemic, right? You can't simply think from your point of view, because there are other several business partners who have a lot more issues than what you may. And you've been thinking, okay, he's my strategic partner, but he may be going on bankruptcy tomorrow, and the strategy is gone for a toss. So main questions would be like, are they considered essential? What kind of suppliers you are dealing with? You need to have a supplier segmentation, whether it's a benchmark supplier, strategic supplier, whether we can take leverage, or it's a transactional supplier. Who is important? When we talk about importance of supplier, not everyone is important. If you take, there's only handpick of suppliers who are critical for your business. The rest, you can, if we are in India, we are not in some island where it's going to be difficult for someone to source items, right? You find PPE were like not a term that was used before COVID. Today, the next door people are making PPEs. I was buying the same PPE $1,500. Today I'm buying it at 150, right? So and if I push for more, I can even get it for free. It's everywhere now. But these people have not even heard about PPE before. I have seen a lot of Asians, especially Japanese, when they travel, they wear masks. We look at them strange, but today no one is there without a mask, and everyone is manufacturing masks. We get it for $30, make in India if you go online, right? So mainly you need to understand what is essential for you today, because we are in a situation that was essential yesterday, today it is not, right? uh, and mainly, did they have trouble sourcing raw materials or run low on critical inventory? Did they suffer a shortage of labor? Because today most of the cases, even the Malaysia case, what I said is all the laborers, they got COVID, and eventually they had to shut the factory. So you need to be aware and cognizant about the fact whether your suppliers are taken care of. If they are going to have COVID and shut the factory tomorrow, then we can't run our business, right? Uh, and again, the transportation issue that I talked about initially. So these are all the main risks that we have to focus on. So once these questions have been answered, then we can start developing, implementing risk mitigation strategies, from immediate action to enhance supply chain resilience that we talk about, reduce future supply bottlenecks, longer term strategies that require a greater investment of time and also resources. So few quick things in terms of risk mitigation that comes to my mind is, the most basic rule is to avoid sourcing everything from one location or from one company. That is something everyone has learned after this pandemic, not to have reliance on just one particular supplier. So we have to look at market. You have to look at a local resource who can give you the item instead of going somewhere and trying to save another 5 or 10%. That's not going to work for us. Maintain additional inventories of mainly the critical items, create regionalized buffer stock of essential parts, raw material or finished goods whatsoever. Just have something in mind. Don't have just in time. That doesn't work for healthcare industry. Maybe it works better for automobile, because the supplier is just backdoor. There's no just in time. He's within the complex literally, right? So if you go to Hyundai today, they have all the suppliers right next to them. So what is the point of just in time? It's like on time, real time. They can just do it, walk and give it to you in the shop floor. So we can't try to copy just in time or these kind of approaches in healthcare, because we try to source somewhere in the corner of the country and try to have all the distribution network, all the intermediators clocking the margin and pushing it finally to you. Whether it comes or not, you don't know. I make a purchase order for 100. I may get 100 or I may get only 90, or suddenly if the supplier is in good mood, I'll get 120. So that is the kind of market we are in. We don't even know what we order and what we get eventually, right? And mainly we have to invest in locations that can provide this multimodal transportation options. We can't find a supplier who is cheap, where there's no railway network, where there's no airport, where there's no transportation, right? Obviously it's going to be cheap for him to manufacture something in that cost. But you need to be aware of your key manufacturer's location, what kind of transportation. If there is a lockdown, can he risk something and get me the items or not? So these
Right.
are the key elements what I've been looking at.
I think what I could pick from the conversation was vendor assessment is very critical, is what I could realize. Do not ape what you could do in the other markets or other segments here. I think risk is there. I love the point that risk is there everywhere and daily. So if you analyze your risk daily, chances are you will not end up, managing any crisis, is what I could hear. So I'll just quickly open up to the two panelists, Nair sir and Muruganathan sir. Any quick points that you want to add to Madan sir's
No,
conversation? Said
Madan
it
has
all.
covered everything. Nothing is.
Madan pointed out like risk is there always actually.
I
And
loved it.
mitigation measures, like I would say that you can't cut and paste. It has to be, developed individually to suit individual hospitals, basically. That's where the ACM, the finance guys and the management guys should sit together and work on it. How much to have and for how long the coverage should be. It all it varies from one institute to another institute. They have to really work with the data, create different buckets, and create mitigation strategies for different mitigation strategies for different bucket items.
So I
That's
think what I could.
Christian, what like Madan was saying is like it is from the serial web series Scam. Risk है तो risk है, the supply chain है तो risk है. You can't get out of it.
Good one. You are absolutely right. I think what we all do and what we have done in the last 9 months is manage our own personal, professional, so many risks. I think risk is everywhere. I sort of agree to more or less all the points that came in. And I think it's already 8:32 hours. So there is about 5-10 minutes, which I want to sort of quickly sign off. I'm going to twist the last session, which was the master's mantra, a bit. And I'm going to twist it in a fashion where I'm going to ask you, you're already, looking at so many supply chain folks. Now, we are the only, so-called people here. As a manufacturer, if you want to give out a message to the supply chain folks and the manufacturer, what are the messages that you would possibly give now, apart from what you gave in the earlier piece? Any quick points that we want people to remember, us to remember? And I'll start with anyone. Please, I'll begin with Madan in this case. Madan.
So just one point, I would say, don't try to cut cost when in pandemic. Pandemic comes with a cost and we have to pay for it, right? So if you try to reduce the inventory, lower the cost, this is not the time. Just pay for it and see how we can get back these savings in your future strategies. But now there is no pandemic that is cheap. That's my main message I want to give to you.
Great point. I think don't cut cost and and maintain the quality. Great. Thank you, Madan sir. Yes.
Yeah, Krishnan, like every time we say MERIL has been, I know during the pandemic, your company had stood up and helped a lot of people, a lot of hospitals in getting PPs and all those things. Continue doing the good thing, but more importantly, I think now you have to come into a structured system of helping all these small hospitals, city by city, making a conglomerate of around, say, 10 or 15 smaller hospitals, common purpose. And if you can, it's the most difficult thing to do, but then if you're not going to do it, then why be there? That's as simple as that. So make a sort of group, help them with their buying things, because you come with a lot of intellectual properties which they will be able to use it. Their only role will be to get a formulary in place, and then you can join up and create a win-win situation for everybody. I think that goes a long way.
I'm glad you're putting this point, sir. We've just launched our Prayas, and the Prayas is actually aimed at not the large hospitals, but the standalone and the medium ones. We are willing to stretch our hand and help them, because being an indigenous manufacturer, we also have many things on our side. We're actually extending our hand. Please come and talk to us. Our teams are more than waiting. We'll be more than happy. And that's what the cadence our chairmen have given us. First focus on the country, and then everything else can fall in place. So thank you for that piece of advice also. Really appreciate it. Muruganathan sir.
It's, I look at it like win-win all the time. It's not that one-sided. Look at various opportunities which are there with bigger setups. Try to take them along in extending support to the lower segment of hospitals actually. So one area which I always keep talking about is GPO. Like it can be driven by any of the supply source giants actually who are having big base in India. That's one part. The second is like other area which as a manufacturer you can look at as like extend an arm, a digital arm wherein anyone can pitch in, let it be a bigger setup or smaller setup, which in have their rack rate defined based on their consumption and have a fair procurement process. Instead of doing legacy work of calling for quote, negotiating, instead you can categorize based on the rack system or box system, whatever you call it, like sale at lot base.
Sure. I think it's a great feedback. In fact, even for all of us, I think, including the participants here, it's a time to relook at many of the elements of the past and maybe redo them, redesign them, and maybe rethink on them and re-energize them. There's a lot of but I think it's important as we go. So with that, what possibly we'll do is we'll quickly pause the conversations. We have had 2 hours like passing this way. I didn't realize I've been talking so much, but brilliant hearing you. I've noted many things. So my diary is actually full. I'll try and send out some things to you. So I'm going to pause here. And Emmanuel, if we can quickly go over to the participants. We have 3 panelists. And if they want to ask any questions, feel free to ask that. And by the way, we still stream this on YouTube. In case you've missed any points, you can go to YouTube back and maybe look at the entire conversation again. So over to the participants. Please go ahead. A lot of people posted in the text box, and I'm sorry I could not catch up with that. If you can repost your question, it will be really good. Or maybe unmute yourself.
So there were 3-4 questions, which I think Sajan sir addressed one or two of them. Hello.
Yeah. Go ahead.
And even Madan sir and Dr. Arora sir also answered. I don't see any questions pending there.
Oh, great. So which means I can only see comments. My CFO given me cash flow budget to manage on my own. I think Rajesh has made that comment. Thank you.
One question is like, demand government to compensate our loss with proper way. That's something, a suggestion, I believe.
Yeah. I think that's it. I'm not too sure if anybody wants to take that. I cannot take that question in terms of how to ask the government to compensate losses.
I will just take the next one. I see the won't get sterile PPE for 150, so I need to thank my purchase guys, I guess. So maybe I revealed the price what we are buying it. But yeah, if you do the proper market research, you may get some. You just need to do a little more exercise on that.
Great. So any participant wants to make any comment, I think this is your time before we
Yeah, I have one question to both Murugan sir and Madan. Just I am posting also. See, there is any such possibility to counter this pandemic's shortfall, like FCA, Food Corporation of India, like that for us corporates. Do you have any such central warehousing concepts? Because there is a huge situation arises where the crores of rupees come as an impact when we projected if we are going to handle a 50 patients. But now anyhow we managed it very well. From crores to lakhs we manage. But still, like Madan sir said, no gloves, no things. It is going to take another year to get a normalization. But the prices are double. Just it is one my doubt. Is any possibilities? Because all big people
does it mean, Rajesh, that you're talking about a central warehouse where people share out of that?
Yes, budgeting from corporate sites we will allocate. So like FCA model, Food Corporation of India model.
It's a very interesting concept. I don't think except for the government, which is already procuring from the GEM side and maybe giving out to their own hospitals, I don't think somebody has thought through that. So yeah, I don't know. So I would encourage people who interact with the government very regularly on this side, especially Nair Saab, Muruganathan Saab, and if you have any inputs on that.
But my wish is that from the corporate side, not from the government anyway. They have the power to acquire the manufacturers. Even tomorrow they tell Merrill, supply all the stands to government. So you are helpless. But what my expectation is that even like nowadays, a lot of third parties coming like Medica Bazaar or Aknamed. You people are heard.
Entero is
Yeah,
there.
yeah, but not in such a way. Just contribution should be there from the corporate side, and we will secure some of the stocks. But anyhow, pandemic. What else the pandemic requires? All the items are not much, hardly 50 to 60 items.
So I have actually a question on this question of Rajesh. I mean, just a quick question between you people: that have you actually reached out to hospitals next to you and asked them, do you have anything? Has that partnership happened? I don't think we covered that.
Yes. Actually, through the vendors we reached, in particularly in my case, I brought it down the PP cost in the within week time from 1,500 to 150 rupees. So we pulled out all the materials, and near to me there is a garment industry in Calcutta. I think you are aware. So they shut down entire their garments because of the pandemic. I engaged them. So this went like a viral. So material was not available. Material used to come from the north. So that was one thing. Wherever we have a materials like SMM, this was the thing. So hospitals also followed me with my circle.
Thank you, Rajesh. Thank you. Appreciate your point. Anybody else? Any other points?
Yes, Rajesh, just to answer your question, shall
Sure.
we initiate a kind of central warehousing concept? See, we do have central warehousing concept, but we serve only to our own group of hospitals and our own joint ventures. And that's where I feel like if there is a strong GPO, Madan will also point out that if there is a strong GPO with a clear understanding from various, between them and the supply chain sources, actually. So this requirement of central warehousing can be served to some extent.
I think point taken. So yeah, Gopal, you actually raised your hand. Please go ahead with your question.
Sir, actually, my question is that now I am in medical college basically in last 5 years. Mainly, our motto is low cost medicine and all. Sir, presently, our CM declared that every person have Sastosati card. So, sir, Murugan sir, basically, you have a chain of hospital in overall all India. So, how you will maintain the cost of different state? After 4 and 5 months, every person have Sastosati card. They haven't any corporate. So, then what will be the effect in supply chain after that?
To mitigate that, the cost pressure on us, we have a kitting system for procedures which are coming through schemes actually.
Hello.
I hope you got your answer, Gopal.
Yes, you got my answer?
Yes,
See,
yes, sir.
We don't go by basically individual requirement of patients, in the sense like category of patients. We don't discriminate between the scheme patients and the paying patients. But to mitigate the cost pressure, what we have done is we have created kitting system for most of the procedures which are coming under schemes actually. And there are restrictions which, with the buying from the physicians and surgeons, we were able to manage that. But by and large, if you ask me, as it's a balancing act which we are doing it, there is no discrimination between general patients and the scheme patients to a great extent, barring few specific procedures.
You made a very good point that if you actually can sort of get a kit out, you can actually get already the costs of the overall procedure down by about 20%. That's a great
question. Like what he asked is asked a very, very good question. Thank you, Gopal. But like I will tell you, angiographic kits would all cost only 1,000 rupees, right? And that includes all inclusive. It all depends upon the care plan. You have the fixed care plan, time, diet, kaunsi dawai dene, everything is fixed, right? So hardly 100 cases, only 10 of them fall out of that case. Otherwise, 90 of them fall within that case of 1,000 rupees. 1,070 is the cost which we worked out last time with the scheme patients on angiography. So that gives us good enough amount of money. Even any scheme would not be giving less than 5,000 or 4,000. So that gives us enough amount of money to play around with our operating expense, salaries, and all those things.
So planning is the key here, and understanding of the
Planning
subject
the
is
whole procedure and working out with the supply chain makes it very easy.
very easy. I'm glad. So basically what you're saying is supply chain actually can play a very key role when in such times of crisis, if they actually plan well and think well on the entire attribute. Great.
But for that, the supply chain has to be inclusive. They have to move ahead from their rooms and move into the wards and ICUs.
Oh, that's a brilliant point.
Actually, sir, basically, I am working last 5 years in medical college, and our motto is patient, and patient, but not a quality patient, total number of patients. So that's why.
Gopal, don't worry. I worked till 2010. I was in a medical college as a professor of microbiology.
Yes.
So I
Yes,
can
sir.
understand and feel your emotions. Right?
Yes, sir.
Our motto was also patient, patient, and patient only. Our motto now is also patient, patient, and patient only. Only thing, they are little paying, so we are surviving.
Yes, sir.
And I'm glad,
Thank you, sir.
profit motive in healthcare is not a bad thing, because unfortunately capitalism is there, but conscious capitalism is something that I think everybody is recommending. Great. Any other questions? I think it's really late in the evening, but I'm assuming there are no more questions. The only thing I can do with my folded hands to all the panelists is really thank you for coming in. With my folded hands to all the supply chain participants, I hope they benefited with what we tried in doing. Our teams are there. Please reach out to us for any help, anything that you wish. Please stay safe, and one round of applause for everyone, especially the supply chain folks, being the silent partners in all their journeys. So from our side, I think a round of applause to everyone. God bless you. Until we meet again for the next round of the healthcare industry dialogue. Thanks a lot. Signing off today. God bless you all. Take care, and namaskaram.
Thank you.
Thanks.
Thank you.
Thank you.
Thank you, sir. Thank you, sir.
Thank you.